question. How do I handle hair pulling? So, hair pulling can happen for lots of different reasons, and hair pulling can be a symptom of lots of different things. And in fact, hair pulling itself can be a constellation of things. So, there are some folks who pick their skin or who bite their fingernails. And it can be sometimes related, or we'll pull hair in different places or twist hair in different places. And so hair pulling all by itself, you need to have a very thorough psychiatric evaluation to make sure you're in the right ballpark, because it could be anxiety, it could be panic, it could be trichotillomania, it could be a nervous tic, it could be trauma, it could be all sorts of things. So make sure that if you see that happening, that you refer that person to have a full and thorough psychiatric evaluation or psychological evaluation, because depending on the cause of the hair pulling, you want to make sure that you're using the right intervention. Now, when it comes to certain types of interventions, there's kind of behavioral interventions where you can incentivize people out of certain behaviors. So, hey, if you don't pull your hair, you get X, Y, and Z. Or every time I see you pull your hair, this will happen to you. And that's some of those are positive and negative reinforcements or positive and negative punishments. And so those are all strategies that a lot of behavioral therapists can use. If we feel that the hair pulling is related to like trichotillomania or to some type of anxiety, a lot of times you can use medications to help break the cycle of that stinking thinking, to help break the cycle of OCD. And there are some really effective medicines that are really safe to use under the supervision of either a psychiatrist or anybody that is licensed to be able to prescribe those medications. CBT, so cognitive behavioral therapy, is also really, really helpful for breaking those cycles of obsessions and compulsions, or feeling like you have to do something. And if you don't do it, then you start to feel bad. And then there are other modalities that I know of. I don't quite know how they work, like neurofeedback or biofeedback. But the idea is essentially you listen to the kind of energies and the rhythms of your body. And then as you do different exercises, you can change those rhythms and change those energies and those neural pathways, those brain pathways, so that then you can break those habits. So the key is figuring out what's causing the hair pulling, and then tackling it either with medications or non-medication interventions, just depending on what's going on. The good part is oftentimes, especially with hair pulling, oftentimes the hair will grow back depending on the healthiness of the skin underneath the hair. And so I tell quite a few folks, just kind of let's do our best to feel better first, and then the hair will grow back later, so that you can feel kind of more in line with all the social people that you're around.